Hello everybody, and welcome to my YouTube final project for Biology 1406. My name is Lexi Holton, and today we're going to take a look into the fascinating world of genetic disorders, particularly a genetic disorder called Marfan syndrome. Now, some of you might be asking yourselves, what exactly is Marfan syndrome? Well, I'm glad that you asked. According to the New England Journal of Medicine, Marfan syndrome was first documented in 1896 when the first professor of pediatrics in Paris, Antoine Marfan, described a young girl with long spider-like fingers and curious skeletal abnormalities. As time went on, research began on the disorder, but it wasn't until 1996 that clear guidelines were set to actually diagnose the disorder. That's 100 years just to determine diagnostic guidelines. Marfan syndrome can now be diagnosed through clear acknowledgement of symptoms and further genetic testing to confirm suspicions. According to the Marfan Syndrome Foundation, some signs are easy to see. So what exactly are some of the symptoms we can see from Marfan syndrome? Some of them are easy to see, and then some of them are not so easy to see. Some of the external ones include long arms and legs, fingers, tall and thin body type, curvature of the spine, also known as scoliosis, sunken or protruding chest, flexible joints, flat feet, and crowded teeth. Other symptoms are not so easy to detect. Some of these include heart problems, especially aortic heart issues, sudden collapse of lungs, eye problems including extreme nearsightedness, dislocated lens, detached retina, and early onset glaucoma. Specialized testing is needed in order to confirm these. According to the Dove Press, detection of FBN1 gene in a patient highly suspected to be affected by Marfan syndrome may allow an early diagnosis, which in turn permits preventative therapies and more accurate clinical follow-up. These tests include X-rays, MRIs, and prenatal testing. For example, a case study published by the U.S. National Library of Medicine, a 34-year-old young man diagnosed for the first time with Marfan syndrome after being admitted for chest pain due to strenuous physical activity. His medical examination discovered severe aortic root enlargement and aortic hematoma. During open-heart surgery, unfortunately, the patient passed away due to his condition. I find it important to note, however, that while these situations are a reality for some, for others, early detection is key for a positive prognosis. Most people with Marfan syndrome, when detected within a timely manner, can live a full life into adulthood, some into late adulthood. Symptoms such as heart issues can be managed through surgical correction or use of medications to ease strain on the heart, such as calcium channel blockers or ACE inhibitors. Bone and joint issues can be managed through surgical correction for scoliosis or chest abnormalities, braces for supportive joints, and anti-inflammatories, to just name a few. Now let's be honest. A lot of this information sounds a little scary. So here's the question. How do we know where in our bodies Marfan syndrome begins? It's a good question, right? Through genetic research, we've learned the origins of Marfan syndrome in our bodies. It all starts with chromosome 15. Marfan syndrome is a product of a mutation in the FBN1 or fibrillin gene on chromosome 15. Fibrillin is a protein that is essential for the formation of elastic fibers found in connective tissue. Because of the mutations of the FBN1 gene, the glue that holds connective tissue of the heart, eyes, and bones together is weaker than in most people, which gives way to the issues we discussed earlier in this video. So who will get Marfan syndrome? Who exactly is at risk? Some people may be diagnosed with Marfan syndrome with absolutely no family history whatsoever. About 15 to 30% of all Marfan cases are due to de novo genetic mutations. However, most people with Marfan syndrome inherit it from an affected parent, either their mother or their father. Marfan syndrome is an example of what we call an autosomal dominant disorder. This means that only one parent needs to carry the gene to pass it along to their children. So, If there is one unaffected parent and one affected or predisposed parent, their chances of having a child who is affected with Marfan syndrome is about 50%. I hope that I've clearly explained that to you all. That was a lot of information, right? In closing, I'd like to say thank you for watching my video, and I hope you all learned a great deal about Marfan syndrome. Thank you.